A good day to you, ladies and gentlemen. So I'll be taking you through a radiopharmaceutical drug which is Strontium H220704M. It is in a class of drugs known as radioisotopes. Strontium 89 chloride is used in radiotherapy. Its generic name is strontium chloride, that is SR89. Its brand name is Metastron. The radioactive strontium is taken up into the bone cancer area. So, as you can see, I've managed to insert a diagram for you so that you can see the structure of strontium. The mechanism of action of strontium 89 chloride. Strontium 89 chloride concentrates in areas of increased osteogenesis. By osteogenesis, I'm simply saying areas of increased bone formation. It is taken up into the organic matter of the bone. I guess you all know from anatomy when we are talking about osteogenesis and when we are talking about organic matter. Strontium chloride 89 presents a tenfold higher affinity for metastatic bone. Metastatic bone. This is when cancer cells break away from the original tumor and spread to the bones where they begin to multiply. After being incorporated into the osteoid matrix, it emits beta rays. Thus, there is possible tumoricidal effect. Thus, an agent destruction of the tumors in the metastatic bone. Then we are going on to pharmacology. Strontium 89 chloride injection is indicated as a palliative for the relief of bone pain. By palliative, I'm saying this is a drug or medical treatment that relieves suffering without treating the cause of the suffering. This is done in patients with skeletal metastasis. It is important to confirm the presence of bone metastasis prior to the beginning of the therapy. Metastatic bone lesions lead to more rapid bone loss. So by saying we have to confirm, we can't just expose the patient to radiation when we don't know where exactly the metastasis of the bone is occurred. So there is constant need of calcium supply. Thus, strontium chloride acts in similar ways as calcium. It is then taken up by sites of active osteogenesis. That's active sites where bone formation occurs. As the diagram entails, we've got a person undergoing a bone scan. That's to see where the tumor is. Then after noticing the tumor, strontium 89 chloride is then administered on the tumor. So, that is what can I say? An X. Is it an X? The diagram is showing before and after the strontium 89 chloride has been injected into a patient. So, route of administration. Strontium chloride 89 is administered through the intravenous route. Thus, this drug is injected into a vein or a catheter that has been placed in a vein. Then the uses of strontium chloride 89 in radiology. Strontium 89 chloride delivers radiation to cancer sites. It ultimately decreases bone pain. The length of treatment depends on type of drugs one is taking, how well the body is responding, and the type of cancer. I think this is self-explanatory. Then we are going to precautions. Patients taking on strontium 89 chloride have to tell their doctors and pharmacists what prescription and non-prescription medications they are taking, especially aspirin and vitamins. Then they have also to tell their doctor if they have ever had a bone marrow disease, blood disorder, or kidney disease. They should also notify any healthcare professional especially other doctors giving them treatment that they'll be taking strontium 89 chloride. They should not have any vaccinations. That means vaccinations for measles or flu shots without talking to their doctors. They should also tell their doctors and pharmacists if they're allergic to strontium 89 chloride or any other drug. Then we are going on to side effects of strontium chloride 89. It causes increased pain starting 2 to 3 days after treatment and lasting 2 to 3 days. Then there's flushing, diarrhea, fever, chills, or sinus. Then I have got references if you want more information about this drug. Thank you, ladies and gentlemen, for listening to my presentation.